Dr. Janani, ENT and facial plastics. So here we have with us a patient planned for Botox for her forehead wrinkles. So with respect to Botox, we have to have three major understanding. First one is the forehead shape, the size, whether it is a short or a long forehead. That would be the first. So second would be understanding the muscle strength. So the first step would be understanding how big the forehead is. So whether the patient has got a short or a big forehead. And the second step to understanding would be whether the patient wants a conservative or a more frozen approach. The third step would be the understanding the anatomical aspects to it. So in our patient you can see, if you look closely, can you look up? Do this? Yeah. So there is a little bit of both static and dynamic wrinkles. So this would constitute the dynamic wrinkles. Can you look normally? So here we can also see static wrinkles. So if I were to map it, the wrinkles go somewhere like this. So before we go on with the injection, we have to consider three anatomical pointers. One would be the orbital crest. So this would be the highest point which would constitute to the orbital crest. And then we have to take may I have a scale? So the 2 centimeters above this would be our danger area, which we are not planning to inject here. So 2 centimeter here, I will refrain from injecting. And above that is where we are mainly focused about. So this would be the first anatomical point, and the perpendicular line to it, the temporal crest. If you palpate it here, I can feel her temporal crest here. So a perpendicular line, that would be the second anatomical point. And of course, this would be our danger area where we are not going to inject. So this is the area where we are planning to inject mainly. So after understanding the anatomical aspects, we have to go for in-depth understanding of the pattern of the wrinkles, for which there are three major considerations. Understanding the muscle anatomy. So after this is where we are go into the deeper understanding. So after this, we plan for a deeper understanding how much we are going to inject based on the anatomy of the patient. So first would be understanding the muscle strength, how thick or how strong the muscle is. So basically with Botox, we are making the frontalis paralyzed. So we are basically injecting the toxin here to make it taut like this. So we don't want a heavier brow, which is an inadvertent effect if it is injected improperly. So we don't want that. We want a good taut muscle, but also without compromising the brow. For this, we have to inject only in this area. So the first step would be understanding how strong the muscle is. So can you look up? So you can see her muscle is pretty strong, and you can see there is a lot of contraction here. Minimal contraction. Right side is contracting more than the left side. So muscle contraction is uneven. That would be the first step. And second step is understanding the pattern of the waviness of the wrinkles. This is going to help us give an insight about the irregularity of the muscle that we are dealing with. You can see here, the patient has got an irregularly patterned out, waved out wrinkles. So I have taken out pictures just to have an understanding. So this is a first figure where I've drawn out examples, I've drawn out wrinkles, how it's going to vary. So this would be the first pattern where there is a uniform regularity of the wrinkles. So this would be easy. We have to inject points exactly on the areas where there is wrinkles. So here I have drawn out figures to understand how the waviness or the regularity or the irregularity of the wrinkles would be. So this would be the first variant where there is a uniform regularity. So our method of injection is going to be simple. We'll inject wherever we have peaks and troughs. So this would be the first way of injecting. This would be the second scenario where there is irregularity of the wrinkles. There is ununiform crest and trough. So we will inject wherever there is excessive trough. So this would be wherever there is excessive trough, we'll be concentrating more or injecting more on those points. So this would be the third scenario where there is lot of peaks and less of trough. So we'll inject only on the peaks. This is an ununiform pattern again, but again, as you can see, it is extending beyond the temporal crest. So we'll be needing a little bit of injections here as well. So the next step is understanding how the hairline behaves. So in some patients, when the patient is looking up, can you look up please? So you can see, can you look down? Concentrate on the hairline please. Can you look up, look down, look up, look down? So you can see the hairline is moving forwards. Whenever a patient is looking up, the hairline is moving forwards. So in these kind of cases, we have to inject a little bit on the hairline level as well. This will make sure our hairline, because this muscle is going to get stretched out, whenever the patient is looking up, the hairline will cause a sagginess from above. So we don't want that, right? So we might need a little bit of injection at the hairline level as well. So planning out her injection, can you do this? She has a little bit of procerus as well, procerus hypertrophy. So we'll be injecting a little bit on the procerus, and we'll plan out her injections here. So I go with 6-point to 8-point injection, but since the patient has a broader forehead, we can go with 10-point injections as well. And little bit here because I can see a trough here. And I don't want to go beyond this point. But again, there is a trick to this particular case where the patient wants a brow lift as well. So we are concentrating on little bit lateral brow lift with Botox itself. So I might inject a little bit. If this is going to stretch out, this will sag down the brow. So we cannot inject very close to it. Maybe a little above, we'll inject a point here and a point here. So mapping out the injection points help us understand better and achieve the desirable results which we are planning for. So let us apply numbing cream for her, and maybe after half an hour, we'll go ahead with the injections. Thank you. So we have to apply a very thick coat of the numbing cream, which is nothing but the lignocaine gel or cream. So thick coat. So let it incubate for half an hour and then go ahead with injecting. Concentrate a little bit on the hairline. Hi, hello, this is Dr. Janani. So today we're going to have a patient who's planned for Botox injection for her forehead wrinkles, and also patient needs a lateral brow lift, so a little bit of cat eye. And we're going to give that definition to this particular patient, which we'll go ahead with. And a little bit lateral lift. Okay, yeah. That is what we are planning. We don't want a uniform lift, right?
Yeah.
Okay. So we are planning for a lateral brow lift as well. So wherein we will be inject a little bit, just a little bit on the lateral part of the brow. So to understand it, if I inject here, the point of spread would be as much as this radius. So this would be 1-point injection would cover this part of the area of the frontalis. So our injection should be spaced adequately such that each do not meet with other. So that is how I planned out the injections. And with respect to brow lift, our patient wants only lateral brow lift. So to understand it, if we want a complete brow lift, we would be injecting more on the medial aspect, which is going to pull the brow down here and allow unopposed action of the frontalis, which is going to be elevating it. And here we'll be injecting again, which would pull it down. So to get a brow lift which is in the medial aspect, we would be injecting differently. Whereas with respect to cat eye or a lateral brow lift, we would be injecting mainly along the eyebrow curvature. So I would be injecting very superficially along the curvature of the eyebrow, which would give a lateral lift here. So to understand it better, we know there is corrugator superciliary muscle, which originates deeper, but it attaches superficially. Can you do this? So it is, you can see for her it stops somewhere here. So there is no point in injecting laterally. We have to go inject if at all required medially. So this part I'm going to omit. Can you do it again? Her procedures is only mildly obvious, so I can inject just a little bit here. I'm more focused on the irregularity or the unevenness of the forehead wrinkle and the little bit lateral lift. Can you look up? Yeah. So this would be point 1, 2, 3, 4, 5, 6, 7, 8, 9. And less in the sides and very like 1 or less than 1 for the brow. And bite maybe. I'm going perpendicular at the frontalis.
Little bit. Inject superficially. Yeah.
You got a very good pain threshold.
You're feeling anything?
Yeah.
Little bit, right?
Yeah.
Okay. Now we are going to start on your this area. Open your eyes. See straight, middle.
Yeah.
Just here. And don't blink. Okay?
Maybe 1 unit should be enough.
2 units you can give, no issue.
So you have to sleep. You cannot sleep for the next 8 hours, 6 to 8 hours preferably, and try to sit. Okay?
At least
Sit
5
upright.
hours, I told you, 3 hours, it should be straight position, okay?
Okay.
And then like 5 to 6 hours after, if you're lying on by, right now it's going to be 6 o'clock.
Okay.
By 11 to 12 o'clock, you can go for sleeping, okay?
Okay.
But don't massage your face.
Yeah. Sure.
Don't apply any makeup or anything, okay?
Okay.
Until tomorrow, nothing. Directly we are going to go for surgery, okay?
Okay.
Okay. You might have little bit tightness here. Don't try to do this. Don't try to do anything. Like be expressionless for the next until tomorrow. Expressionless as in don't frown. Don't. Smiling is fine. Don't frown. Okay.
Yeah.
There will be unevenness of the forehead. It will settle down. Okay. And no green tea today.
Okay.
No green tea. No hot beverages.
Only
We don't-
like
Lukewarm.
Okay. No,
Yes.
Normal will be fine. Like if you want coffee or tea, you have to avoid it.
We don't want to metabolize it.